Well, October is National Sudden Cardiac Arrest Awareness Month, and with the stress of the election and the upcoming holiday season, yeah, it's the perfect time to talk about heart health. Joining us now, Assistant Medical Director from the Cajon Urgent and Cardiac Care Center, Dr. Harris Niazi, with the latest on how we can keep our heart healthy. So tell us a little bit about your center here, Doctor, and how you guys are helping keep our ticker in top shape here.
Well, thank you for having me.
Absolutely.
So our center opened up a little over a year ago. Family Health Centers of San Diego, we opened up a cardiac and medical urgent care center out in El Cajon to serve the underserved population in East County. That was made possible through the help of a $1 million grant from Blue Shield Promise. And through our partnership through the Cardiovascular Institute of San Diego.
Gotcha.
We serve a wide variety of underserved patient populations, including refugees from Afghanistan to the Hispanic and Latino community. Their healthcare literacy doesn't tend to be very strong, so the patients are very complex. They have untreated or diagnoses that have not been made yet, and they come to us seeking for help for urgent medical and cardiac conditions. And our job is not to just treat the acute conditions, but to also provide comprehensive care and plug them back into primary care and other services that we offer.
With the holidays that we have coming up here, look, lots of stress. Halloween's about to be done. We've got the election. There's election stress. What could people be doing now to keep their stress low and their heart healthy?
Yeah, I think you're right. The holidays is definitely a stressful time for many folks. You know, there's financial stresses, there's the holiday stress, there's election stress.
That's true, right.
So there's many things you can do. Checking in regularly with your primary care provider, understanding your family history, your risk factors, quit smoking if you smoke, exercising regularly, partaking in relaxation techniques. Watching what you eat, not overeating, not over drinking, which we know in the holiday season.
Happen around the holidays,
Absolutely. So just being mindful of what you're eating, what you're putting into your body, and what you're doing every day, I think helps.
If someone looks like they're having a condition or they're a heart attack even, or they're just not doing well, or grabbing their chest, what should be done right away? Walk us through that.
So of course, if you think you're having a medical emergency, you're having a severe chest pain, difficulty breathing, you think you might be having a heart attack, you should call 911. You should never drive yourself. You should have family take you to the emergency room, or an ambulance preferably drive you to the nearest emergency room right away.
Okay, and if they were at your center and they had some concerns, you guys can help them get back on track?
Of course. So we're not the emergency room, but we are capable of handling most non-emergencies and stable patients. And part of that was made possible through the $1 million grant that we received through Blue Shield Promise, which equipped us with the diagnostic studies that most urgent cares probably don't have. You know, everything from EKGs, cardiac monitoring, to troponin testing, on-site cardiology consultation through the Cardiovascular Institute of San Diego, and even further outpatient workup if needed for specialized cardiac studies.
Like you guys have all the tools there.
We have everything on site, but again, we're not the emergency room, but I think our model helps determine if you could be seen safely there, or it truly is an emergency and we need to transfer you out.
It's good to know that ahead of time, that's for sure. Doctor, we got to run here, but tell us a good website where people can learn more information, learn more about the center.
Of course, so you could learn more at our website, Family Health Centers of San Diego, fhcsd.org. We offer a wide variety of primary care services, pediatric services, prenatal, vision, mental health, dental. So
thanks for coming in, Doctor. Appreciate it. Thanks for keeping us healthy.
Of course.
Take a quick break.
Thank you.